Dr. M.Z. Desai is heading the Navjivan Heart and Cancer Care Hospital. He has obtained a great success in treatment of last-stage cancer patients and relapse causes of cancer and heart without surgery, providing latest painless procedure and facility to treat deadly and unbearable pain, causing alignments with latest non-invasive technique which relieves severe cancer pain instantly. And there is a reversal of this disease as well. The topic of today's presentation is healthy extension of life by NAMS PTS. So I'd like to ask Dr. M.Z. Desai to present his presentation. Thank you.
Very much, and very good afternoon to all the delegates, renowned doctors, and successful cancer researchers. I am here today to address and talk about the healthy extension of life, which is painless life, with the treatment and help of the routine, whatever conventional methods, as well as supported. I'm supposed to, and I'm going to talk on the healthy extension of the life in cancer patients and some of the stubborn diseases. And just to start, or before I start on the matter, I would like to do a little going back into the cancer. Since last 55 years, we have been struggling, trying hard, and trying to get control on the cancer by various means, by many advanced machineries, radiations, chemotherapies, painless chemos, or least side effect giving chemos, etc. But then overall, looking at all those sort of, the heavy hard work and when talking on the attempts and so much of a work has been done in last 50 years. But then there are some disappointing things that have developed in the world, like earlier the average age affecting the patients were around or after 50s, 60s or 70s. But nowadays it has come down to 40s, 50s, and still earlier to that. So our task has gone up in these matters. We have to control these things, and we are working hard. Each and everybody who is working in cancer field is trying his hard and trying to get best results out of it to arrest the cancer by whatever means. So what I was, when I started with these works a few years back, almost 25, 30 years back, when I saw that whatever we do, the things are not enough to help us arrest the cancer, to help us reduce the signs, symptoms, extend the life, and all that thing. Therefore, I little changed my ways and went into supportive non-pharma as well. And surprisingly, I have got best results with these additive supporting medications and means and measures, which actually reduce the signs, symptoms. Mostly it reduces the symptoms of the patient. Patient becomes painless and he doesn't have all those temperature, pain, oozing, gaping wounds and whatnot, and ultimately psychologically, mentally, and even otherwise. He feels better, he comes back, and his life definitely is extended because of all those things, because these things, they help in extending the life as well. As a palliative, means and measures are definitely helping to the patients and coming out of his problems, at least extending his healthy life. Now, what we do in NAMS, whatever supportive medications we give, along with the conventional pharma medications, are after completing uh, sort of, the program of the cancer and the treatment part of it, then actually the patients need a lot of care, a lot of other supportive things with him, and that is where we get more help, and the patients are survived during this period. They are getting more and better life. So what I mean to say, that we need to do something extra and something more at this stage to arrest the cancer can be helped by all those means and measures. So here in NAMS, we actually detect and diagnose the cancer beforehand. Now, whatever investigations and other sign symptoms and better nowadays, the investigations are so good. They can give us many things in advance, but not so much in advance. What we have find that clinical examination of the patient, a best clinical examination of the patient. There is one main what I have been more relevant, this thing rather dependent on the examination is that the clinical picture of the patient, his thorough examination of the face and his joints and his other parts of the bodies. These give me a little more information about the diagnostic criteria and diagnostic means to diagnose these patients before he starts getting either investigatively positive or clinically positive or showing some signs on the body or in X-rays and radiation, in X-rays and MRIs, etc. Now here if you diagnose such patients, these patients before in hand, before time, and start helping him, I actually have explored more of oxidants, free radicals, and toxins going on or present in the body. These toxins and free radicals and oxidants, we have got lesser means to diagnose by these methods, but there are much more or many more clinical ways to diagnose these people by these means. And I have been over a period of 15 to 20 years nowadays, we have been very helpful by these diagnostic criteria, which are almost clinical only. And they are absolutely, of course, added by the other means and measures of the investigations, which are far much better nowadays. Now, with these things, if we diagnose all those people, whether he is in an early stage or still not even early stage, before that, and he may attract the cancer-like diseases in his life, and we are able to control all those things in time. Now, these oxidants, toxins, and free radicals detections and treating them, getting rid or balanced, these oxidants, toxins, and free radicals definitely help them a lot. And the patient comes back to either normal or get reversal in his problems, signs, and symptoms. I've seen people who have got masses and doubtful masses about cancer and cancer-like things, and they remain steady and dormant for longer period. If such patients are treated like this and their signs, symptoms and the lesions or the masses, if they remain in a downward stage for more than 10 years, 15 years or 20 years, I think my job is done because the patient doesn't have any active disease or it's not a progressive disease, not an active disease. He remains in a dormant stage and no problems with the lesion that he is carrying on. So we should, and I actually give more preference to such treatments and managements in case of cancer and cancer-like stubborn diseases. Now, to show you some of the slides of some of the patients before I proceed with another further talk of mine. Now, this is a patient where she was treated in Mumbai topmost hospital for more than a few years, maybe almost a decade, and the patient, not decade, almost half a decade, and the patient was operated. This was a buccal cancer, operated, and the patient ultimately landed up in a problem and was bedridden, and she was given no return slip. That is the terminology we use here. That means we cannot do anything. Now you can go home, relax, and wait for your destiny. And this patient came to us in Navjivan. It was almost 12, 13 years back, I suppose. And then we treated this patient. The wounds got healed. The gaping and weeping wounds were no more there. Her speech and deglutition and drinking liquids, etc., improved. And ultimately, she survived for more than 12 to 13 years. She took care of her children, husband, and whatnot. Ultimately, unfortunately, she died of corona recently, and not because of the cancer. Now, this is one interesting case that I can show. And the next one is, this is a tongue cancer. You can see this tongue cancer was treated by non-pharma regular conventional medicines which were completed. The course was completed and then I took over. And after this, the symptomatic and by our methods of bringing toxins, oxidants, and free radicals in control, this patient, you can see within 3 days, within 3 days, how was the lesion coming under control? And within no time, the patient started speaking, eating, drinking, and all those problems. And one can actually see the difference in the photograph only in 3 days, but actually then later on for a 3 to 6 month period of the treatment and management, the patient came out of almost all the problems and was happy for quite lengthy period. Now the next one is this. These are the patients with adenocarcinoma prostate. Both of them. One of them were from military. He was a retired military, and the other one was retired. He was serving in somewhere foreign countries. And these two patients with very high PSA counts and advanced adenocarcinoma prostate, non-operable conditions, and I managed them for this first one, Desai, I managed almost for 7 to 8 years, and he was staying far away from Bombay and couldn't come in his old age because his children unfortunately dropped him and they did not support him his travelings and medication. So I don't know what has happened to him. In last 1 year there is no contact, but then so long he was so good. The other patient is absolutely fine and he attends me once in a year or so. The PSAs and all other counts are absolutely normal. The maturation part is absolutely normal and no sign symptoms. And I'm happy with the healthy extension of these people with little addition of the managements like. Now, the next one, we have got a very good success in brain tumors. Like actually, these 1, 2, 3, 4, 5 patients mentioned over here are actually a few of them. Though all those patients with our toxin balancing and oxidants driving out methods, these people have come back to their normal life and they are living a very good life, extended, no pain, no headache, no increasing mass SOLs in the head and skull. They are absolutely in a sort of state where the things are not worsening or not increasing and they are slowly reversing back to normal. These are actually, I think, the easiest way of the patients to treat brain tumors. We have been very happy with the patients getting results very fast and nicely. So, by these methods of reversal and correcting their oxidants and driving out the oxidants and sort of the toxins, etc., we can achieve a lot. Our achievements are diagnosed well before the first stage or the early cancers, and or treat in a better way, relieve the sign symptoms, and check the progress and arrest the speedy growth of the cancer and make them comfortable and give them the best life. And there are so many, almost 1,000 patients at this moment on record on our database going on. Presently, they are under treatment and they are all happy with this management. Maybe some of them they need radiation, some of them they need chemos, but then our methods are so good adjuvant like, and they are supportive like, because that reduces the chemo. That is what we have seen. Even metronomic chemos or otherwise very little chemo, maybe 1/10 of a dose. We have tried that. Of course, it is not sort of very much sort of happy to go ahead with that. So we will get permissions for such reductions in the chemo and radiations, and ultimately we will prove our points that these things get sort of results fortified, and these patients absolutely are better than getting heavy radiation or heavy chemo. And the side effects, of course, every one of us know that they are really tormenting. They are sort of worsening, and patients are more worried of those side effects of chemos and side effects of radiation. So ultimately, we come back to lesser doses of radiation and lesser doses of chemos, where the medicines which can help you bring down the chemos and radiation, etc., are definitely or should definitely be welcome, and we try to there. We have achieved those successes in our patients, and that I think should be possibly better for the world and the cancer world of the patients. Now the next one are similar patients of we can show. Uh, this is another CML patient who was treated by us almost 7 years back. She was going back to UP and not getting satisfactory results at a renowned hospital. Her husband is a well-known pharmacist and running so many pharmacological. This, this lady was worse while she was going. She was sort of absolutely, she used to get shakings and vibrations and sort of tremors and whatnot, getting headaches like anything, couldn't eat, couldn't sleep, couldn't uh, take interest in anything. And she was relieved within a week's time here, and now she's absolutely free of her sign symptoms. Now, so many years, maybe how many, 7, 8 years or something. And these are the benefits and results of non-pharma healthy extensions of life. Of course, we have got a combined medications as well as we have got only dietic um, means also, dietic lifestyle, non-pharma, and combination of pharma-oriented medicines. These are our achievements in last 15 years. We are having a sort of family of almost few thousand patients surviving for more than 7 to 10 years. And presently, there are many patients going on by the help of all those supportive medications. And we wish we'll sort of invent many medications like this, coming back to the supportive medications instead of going into the explorative surgeries and advanced or extensive chemos and extensive radiation. I would like personally to minimize radiation, chemotherapies, and surgery, and get maximum results and get maximum healthy extension of life to all those patients, even if they are getting a couple of not decades, but sort of 2 to 5 to 10 years. This extension in their life, painless, healthy. I think they will bless the whole medical world, you, me, and all the oncologists in the world. So I thank you all for listening kindly to my research